So forming new relationships. You are already taking this first step. The best way to form new relationships is to involve yourself in activities that you like to do. So these can be something that you're interested in, something that you're passionate about, something that makes you who you are. So for example, these brain injury support groups or education groups. Some people like church groups, gardening groups in the community. I know Columbus has a great Parks and Rec department that you can take tennis classes, you can do hiking, any sort of thing. And it's at a very cheap price if you ever look up theirs. I know that they have actually gotten back to in-person classes if you're feeling not so confident about all the virtual things. There's adapted or community sports, cat cafes, dog parks, car shows, whatever strikes your fancy. That would be something that you would go and meet someone that you would most likely have something in common. Other ideas, Dr. Bachos helped me out with some of these for forming new relationships would be reconnecting with old friends, someone that you've lost touch with. It may help to get back in touch with them. And then even through those old friends, meeting friends of their friends. That just provides a new opportunity. Volunteering, or your family does. Those are other great ways to meet people and people who are going through similar situations to you. There's also event finders. I know you can use that WhatsApp. I haven't used it, but I did. After having a child, I joined like a local mom group, and just people going through similar things are great ways to form new relationships. Dating. So dating during COVID in itself is a challenge. I cannot imagine doing that. I know that there have been some COVID relationships that people are striking up that's who you opted to quarantine with, and more power to you. I'm glad I'm not dating in this time. It would be a little bit difficult. Online dating versus meeting people in person. You may feel more comfortable in one way or the other. That would be your personal preference and whatever you're able to do during COVID. If transportation is even an issue, maybe starting an online dating, and then as you feel more confident and if you chose to disclose more information, you could say why you're not able to drive or something like that. When taking the step for meeting in person, make sure you're comfortable. Choose a place you're familiar with, let people in your support system know, or talk through your anxieties or concerns. If you know that it's a place that you haven't been before, maybe go the day before and just kind of scope it out so you know, like, hey, I'd really prefer to sit in this area. And that might make you a little bit more calm and make you feel more comfortable in this situation that may already provoke anxiety of first dates. If you don't feel comfortable talking about your brain injury on the first date, that's fine. You should just talk about it when you're comfortable and when you feel like you have a trusting relationship, or if you want to bring it up on the first date and because you think it's a major part of who you are, then absolutely bring that up. But that's something that you can decide on your own. Other ideas are speed dating. Dr. Bachos even said that now there's virtual speed dating, which sounds fun in itself. I don't know how you would hop between people on that, but sounds like a fun thing. And then dating apps. So there are disability specific apps. Dr. Bachos helped find a few of these for us. So those would be great if you were looking to, already get the issue out of the way of disclosing your brain injury. I'm sure those have that listed right there for you. So something that you don't have to worry about later on. Or you can do mainstream such as, Tinder and eHarmony, all of those. So if doing dating apps is how you want to go, that may be an option that you would feel more comfortable at first. All right, so the other issues that were on the where you gave us feedback, I can't think of the word there for you. So sexuality issues dealing with arousal. So after a brain injury, erectile problems for men, about 40 to 60% of men may be unable to achieve an erection following their brain injury. This may be temporary or permanent. and about 40% of men report difficulties with ejaculation. Women are about the same, with 40% of women report difficulties with orgasm or climaxing. And although they may be able to complete the activity, they may or may not feel satisfied after the sexual activity. So this is a big problem for almost 50% of people following their brain injury. So there are ways to improve arousal. Women tend to be more aroused reading erotic books. Example, 50 Shades of Grey took off, and I think most of the readers were women. Men tend to be more aroused with visual arousal, so like watching videos or watching their partner do something. Sexual aids can help with erection, ejaculation, climax, and pleasure. Dr. Bachos talked about the pleasurable handout. It's like a booklet. You can find it online. I think this also links to it, but it gives you plenty of different options with if maybe your hands don't work as well as you want, or if you're unable to achieve an erection, options, or if you're able to achieve an erection but unable to ejaculate, different options. They have plenty of also positional things, bolsters, chairs that help with if your mobility is a little impaired. There are all sorts of things in there. So not only just improving your arousal, but helping you stay aroused during the task. So if you are new with a new injury, resuming sexual activity, make sure you receive approval from your medical doctor. These can help with recommendations to make sure that you're being safe, like if you happen to still have a helmet on, or if you have spinal precautions or any bracing restrictions. Some patients who are in this more chronic phase, this may not be an issue for you, but I just wanted to put it in there since a lot of our patients at DOD are hoping to go back right when they get home. Talk to your partner. Discuss your fears, feelings, receiving consent. Talk to your partner if you are having issues like feeling like you're no longer sexy after your injury, or you don't know how you're going to be able to tolerate a certain position. If you talk about it before, it will typically make the whole session a lot better, and you'll be even more connected, improving that intimacy with your partner. Discuss a plan to focus on pleasure. So positioning, follow your medical precautions. This is my dad's side speaking out. Helmet, hip precautions, spine precautions. But also think about if you think standing is going to be difficult, if you have decreased endurance, or seated or in bed. Different options there can help with your pleasure during the task and making sure that you can participate. Change in options. Sexual activity does not have to be intercourse. It can be oral versus manual pleasure. Those sort of things what even may have affected you before your injury may not be your favorite thing now. So give it a chance, but this is where discussing your fears and feelings before will definitely help improve the situation. Environmental considerations. So plan for times when your pain is controlled. You're not as tired and you're in a quiet environment, especially if you know that distractibility can be an issue, or when you're tired, you can get more irritated easily, and pain can be controlled. So also think about when you take your pain meds, does that make you really tired? Is that not going to be an optimal time? Or is that when you feel like you could focus more on pleasure rather than focusing on pain? So timing that up. But another thing to be important, talking to your partner about, it's not that I'm not interested, but I think I would be more interested at this certain time. There are professional resources. There's couples and marital counseling. There's also sex therapists. That is a website there that you can search your local area if you're not from Columbus. If you are from Columbus, Ohio State even has psychologists that are trained in disability, like Dr. Bachos, but she's not necessarily a sex therapist. Sorry, Dr. Bachos. But bringing it up to different professionals, that way you have that support system to talk. So intimacy versus sexuality. Intimacy may be different after your brain injury, not only for the patient, but also for caregivers. Lee Woodruff, her husband was a TV, like a newscaster who happened to be in Iraq, I believe, when a landmine went off. And so this kind of talks about more her point of view as a caregiver and how intimacy and sexuality have changed. She has some good videos, and I believe she also even has like a TED Talk. But if you search her on YouTube, there's plenty that comes up. And she even has some books also. So sex and intimacy are not the same thing. You can have sex with and without intimacy. You can have intimacy with and without sex. So often having intimate moments can lead to wanting to be sexual with a person, or having sex with someone may lead to more feelings of intimacy. So intimacy is kind of going to be that closeness, where sexuality is going to be that act of intercourse or touching, those sort of things. So how do you improve your intimacy? What makes you feel close and intimate with a person? Typically, a lot of people report that these love languages are ways that they improve intimacy in relationships. So every person has about 1 or 2 love languages. I say like all 5. You can give me gifts, I don't care. But these help build that relationship, and it's how you may feel loved. And then how you even feel loved may not be how you show love to your partner. So a lot of people think of love as like physical touch or spending time together, but there are also acts of service, gifts, or words of affirmation. So I know no matter what, every day my husband and I would go to work, and at some point in the morning we get like an I love you text. So words of affirmation are important in my relationship. But then physical touch does not have to just be intercourse. I think people think like, oh, if you're a physical person, that's what you're thinking of. But even holding hands in the car, cuddling, those sort of things lead and build that intimacy. And that in turn may lead to the more sexual activities. But building that intimacy is really kind of a base of a relationship, and a strong relationship. Quality time may just be one-on-one time. No TV on, or no, phones are away, or even just family time at a park. Those sort of things where you're spending time together for certain people may really improve that intimacy, that then you feel better when you're going to those sexual activities. You feel closer to that person. Acts of service can be like my husband tonight, taking the toddler so I can go do a task that, makes me happy. And then when I come back, I'm very happy that my husband was able to do those things for me. Gifts, I think those speak for themselves, that, some people like flowers or a cup of coffee when unexpectedly. The words of affirmation, they may be text, they may be in person, and may just be every night saying, I love you. So looking at those 5 love languages and seeing what makes you feel closer, intimate, and then talking to your partner about that, saying, I really feel close to you after you tell me how proud of you are of me today, or something like that. And everyone may be different there. And like I said, what may be for you may be different for your partner. So not only recognizing your love language, but then how your partner feels loved too. So communication, and this may be more in relation to like dating when you're communicating, but when do you talk about your injury and the barriers it presents? Is this something that you have to bring up on the first date? Is this something you have to bring up during your dating app? Is this something that you bring up later in the relationship? I would say whatever makes you feel comfortable. There's never going to be a perfect time. So if you're waiting for that perfect time, it's most likely not going to ever come. So make sure you are comfortable, and then practice that conversation with a family member, friend, or a healthcare worker. I'm sure your PT, OT, rehab psychologist, even anybody in this group would be willing to sit down and practice that conversation with you so that you feel more confident when the time comes of how you're going to say it. So, right, if you're already nervous or anxious and then you haven't practiced this conversation, that will even make you more anxious. So going through it can help you there. I would say for medication side effects, I would definitely go to your physician for that because we may not know, and especially what you think is a medication side effect, like an anti-anxiety medication. Typically, a common side effect can be decreased libido. So, right, is that part of your brain injury or is that part of your medications? And if you are feeling that it may be a medication that you noticed it more so recently when you've upped a dose or something, if you talk to your doctor, there typically are, various ways to, I'm just giving the example of anti-anxiety medication. There's different medications, and they may have chosen that one based on different interactions with another medication. So if you talk to them and say, hey, my libido has really decreased lately and I wanted to see if it was this medication, if you talk to them, I'm sure that they would be more than willing to adjust medications in that aspect. I would also look at, if you are thinking it's a medication versus potential like brain injury, look at the times that you notice it. Is it kind of a constant, or is it in relation to when you are more stressed? And so that may be more just brain injury rather than like a constant, where if it was like followed by a medication dose or something like that. So to kind of taking a journal and seeing, was I more agitated at that point, or was I not in the mood at all because I was really tired? So like every Friday night, my partner really wants to do it to end the week. So if you're really tired from the week, that may not be the ideal time. So going through that with your partner, that's where it's important to write things down and kind of look at trends. Different timing of your injury can definitely affect not only your hormones, your brain development, but also, where you are in your life for dating. I would say most people associate dating with like younger times, but I would say that is rapidly changing just throughout society also. I would say if your injury is when you were younger, yes, that may present more of an issue because most people are probably thinking about going on dates where you're heavily drinking, and that may not be the best option for someone following a brain injury. So that may present new barriers there. But I feel like that's where if you're participating in activities that you like that don't revolve around drinking or something, that may help build those new relationships and be more appropriate for, what you want in your life. Does that make sense?
You're absolutely right that age is a factor to consider as well. And when we consider those of injury at younger ages, I think there's obviously an impact to the developmental trajectory and kind of how one's body and brain and cognition forms from that point in time. What I will say though is there's two different ways to look at it. One, it can be more impactful or more detrimental in terms of, you're intervening at a crucial area of development in one's life. But on the other hand, what a lot of the research shows is that it also promotes a lot of resilience, that kids have dealt with the injury longer. They've adjusted to life with the injury throughout their upbringing, throughout their childhood, and can actually promote some resilience in that way too. That, adults who have an injury when they're 50 years old and have already been living 50 years of life without an injury, it's a more drastic change in some ways. So when you look at the scientific research itself, it tends to be mixed, and it tends to be a little bit of a curve there, in that there's some good prognostic indicators with younger injury, but there's also some concerns with how it could affect development in, again, bodily, brain, and sexual functioning too. So I think it depends if you're talking a little bit more sexual functioning versus relationships as well. But there's some pros and cons there, I suppose. And again, is going to reflect a lot of different individual differences and different contributions, where the injury was, what kind of functional impact it had, what part of the brain it was that impacts certain areas of functioning, and how that impacts a child's, day-to-day abilities as well.
Yeah, I see it across all diagnoses at Dodd Hall. So I'm specifically on the brain injury and spinal cord injury teams, even oncology patients who may have no neurodeficits, but even patients who have like a new cervical cancer, or something like that, right? They're probably not feeling comfortable having these conversations with their members or family members or even loved ones. What is this going to be like? Am I the same down there? Anything like that. You see that plenty of patients that you don't even think spinal cord injury, stroke, amputation patients, right? Everything can be just different if you're thinking positioning, or how do I have this conversation that I have a prosthetic leg, I'm wearing pants, they may have no idea. But when do I bring this up in a conversation? Those sort of things definitely come up all the time. I am a firm believer after working at Dodd, and I think just even everybody is fighting their own battle and you know nothing about it. And so, right, if there's something that you're not feeling comfortable talking about, I think that if you bring your truth to the table, then somebody else may feel more comfortable coming to you. So you never know who you're impacting also. Speak to, there may not be that return to your normal or your previous, but in the way of finding new ways that you connect to each other. And if that is holding hands more to build that intimacy, or if it is using those words of affirmation, I would say looking for new things that you can do together to help form that bond. And then having those discussions bluntly, if that is just needing to sit down at the table and lay out everything that you would like to do sexually, or things that you're no longer interested in. And I think trying those new things or being more open situations may help build a strong relationship down a new path, because now there may be that caregiver patient feeling at certain times, which can build like that struggle of getting up over that to then become back to partners rather than caregiver and patient. Dr. Bashos, if you have anything to add there.
I think relationships are hard. There is a reason why many people have to, date a little bit before you find the one. There are reasons why many relationships don't work out, or why the divorce rate is 50%. There are reasons for phrases of there's more fish in the sea, of relationships are hard and are reflective of a lot of individual preferences. And I think as you hear, me and Mallory presenting, all of these potential things to consider of, age and time and injury type and all these various ways it could be impacted, and all the various ways the body or the brain could be impacted. That's because this is very personal and very person specific. And it requires a, bonded relationship of figuring out what works for you and your partner specifically. That may work for somebody else, that may not. It's very individualistic needs, and that's part of why, relationships are so hard. You have to find the one that kind of mixes and matches with your needs in just the right way. And I love that Mallory brought up the love languages, It's a little cheesy term, but I do love it. And I do reference that a lot in my sessions with couples after any injury, really. Regarding the types of support that are given and received, and what types of support may be more appreciated for you or more for your partner. You may like all of the types of support, but usually people have like one or two that they notice more or are more appreciated or more specific to them. And I think that sometimes sitting down and having that blunt conversation, like Mallory said, of how do you mix and match with one another, whether it's related to your relationship and support, whether it's related to sexual functioning or sexual needs, or how to meet those sexual needs. And the nice thing is there's lots of options, but it does require that hard work of figuring out how to mix and match. And if you do find that you're not matching in the way that you used to or the way that you hoped, are there other options to try and other ways to match up again?
The Love Languages is a book also, if anyone's interested, and it's a great, pretty easy read. There's not really in-depth. It's saying, the author even talks about how he thought he was being great for his wife if she asked for something and he did not do it the correct way or something. And so it's interesting to see that he didn't realize that getting her flowers without her asking was a different type of gift. So things like that. It's a simple book, but it was in me think a lot about, what actually does make me feel good, and casually dropping hints to my husband, like, I loved when you did this for me. And so giving that positive reinforcement that, right, if you are dealing with a brain injury or have a family member with it, we know that you may have to repeat things several times before it sinks in. So giving those cues over and over again may help. Well, I wouldn't say that if you're dating and you don't meet your lifelong partner on that first date, that is a failure. Never think about that. I always look at relationships as you can take something from each relationship. I learned that I did not like dating someone who gambles, and I did that in college, and learning from that relationship. Or I learned that I did not appreciate someone who didn't enjoy family time, and that is something that I enjoy very much. So thinking about each date, even if you don't leave getting a number or things like that, learning something that you can apply next time, even if that's the first person that you told that you had a brain injury, and right, you got that practice in of telling somebody, and even if you don't see that person again, think of that as a positive. I would also say, sitting down with a partner that you are in a committed relationship with, is, putting yourself out there with those blunt conversations of, I think I kind of want to try reading 50 Shades of Grey, and we'll see if that improves our later on. If I'm more involved in the session, I'm calling them sessions, you can call them whatever you would like, but trying out different things. And just because you tried something and it didn't work doesn't mean that you've already accomplished one thing of getting over that hurdle, right? All right, now we're open to trying new things. That's great. That's stepping over to the next stepping stone. Keep going and just look for those little positives, right? If you don't meet your significant other, what's something that you got to try during that date, or you tried a conversation bit and it didn't go the way that you thought it would. I can see like negative consequences of building that intimate relationship and, not feeling ready for the sexual intercourse. So you could always talk about that. But then also, if you feel like you're building that relationship and somebody else doesn't have these feelings, that can be kind of a blow to people, obviously, like breakups, things like that. I would try to look at the positive aspect of, you probably learned something about yourself during that intimate moment or sexual moment, that bring those into future relationships to help explain more about yourself. So you identify who you are and what makes you happy, and take that into future relationships. But yes, there obviously no one likes breakups. That's why people try to avoid them. But as Dr. Basho said, right, 50% of relationships, marriages are ending in divorce right now. So it clearly is an issue at some points. The conversation is not happening often enough, kind of like that taboo. So I honestly, I think a great thing with anybody who's in a relationship or a peer or even a healthcare provider, I ask the question, and you guys can think that I'm the weird one. Why do they want to talk about that? But that way it's on the table. So if it's something on someone's mind, it's, well, I didn't bring it up, she brought it up, and I'll be the one to bring it up for people. So I do think breaking that taboo is very important, because I think that it topics even just like this one, these difficult, awkward conversations aren't happening often enough, and people have questions about it. I started this program at Dodd 2.5 years ago, incorporating it into our education classes. And you do not know how many questions I get for like private sessions before discharge. So it is something people want to talk about, and it's not happening often enough. And that's so again, if it is hard in a group, and I get that NeuroNights is wonderful, but it's probably not where everyone wants to go talk about personal issues. So I did include my email, and I'm happy to take any emails. I know that if you are still in the system, there's plenty of other, you don't have to just speak to me, you can speak to obviously anybody presenting, but in your healthcare system, talking to your doctor about it, or any PT is able to talk about it, right? We're educated on it,